My name is Linet and I'm gonna talk to you about emphysema. Emphysema is a chronic respiratory disease of the lungs, where there is overinflation of the alveoli causing a decrease in lung function. Normal functioning lungs are elastic and efficient in expansion and recoiling as the air passes through the bronchus to the alveoli for gaseous exchange. With the emphysema, the alveoli stretch out of the shape and rupture, and therefore the lungs lose their natural efficiency. Cigarette smoking is the main cause of emphysema. In cigarette smoking, the cilia, which are usually found in the bronchus that trap bacteria and clear the mucus, are destroyed. And therefore, when they are destroyed, the bacteria is not trapped anymore and there is no clearance of the mucus from the bronchus. Thus, there is infection in the lungs and there is accumulation of the mucus in the lungs. Another cause of emphysema is deficiency of alpha-1 antitrypsin. Alpha-1 antitrypsin is a substance that fights the destructive enzymes produced in the lungs. People with the deficiency of this substance cannot be able to fight the effect of this destructive enzyme. Therefore, they lead to lung tissue damage. There are also other risk factors that facilitate people from getting the emphysema, which include old age. As we age, our immune function decreases. Thus, we are more vulnerable to getting emphysema than the young people. And then pollutants are still another risk factor for emphysema, which can cause inflammation of the airway, leading to tissue dysfunction. Another risk factor is male gender. Men are more vulnerable to getting emphysema than women are. And another risk factor is genetic inheritance. Signs and symptoms. Emphysema progresses slowly. At the beginning, you may have a shortness of breath with just simple things like walking and playing sports, but as it progresses, you may feel like you're breathing no oxygen even when you're seated. Another sign is fatigue, where you feel like you're tired all the time. There's wheezing as you breathe, and there is chronic coughing, which is worse usually in the morning. There is chronic mucus production because the cilia has been destroyed from the bronchus, so there is no sweeping and trapping of the bacteria and clearing of the mucus in the lungs. And there is recurrent respiratory tract infection. There is swelling and increased fluid in the lungs, bluish discoloration on the lips and nail beds, simply because you don't have sufficient oxygen. And then the chest takes a barrel-like shape, which is shown right on the diagram, which is to compensate for this actual dysfunction by expanding. So it takes this shape, it expands. Treatment and therapy. There is no treatment that can reverse emphysema. The goal at this point is to relieve symptoms, to prevent complication, to minimize disability, and to slow progression of emphysema. The treatment can be taken at this point include bronchodilators, which help to relax and open the airway in the lungs. Steroids are taken to reduce inflammation. Antibiotics that fight respiratory infections. These flu shots that the patient has to get every year to reduce infection, to prevent infection actually. Pneumonia shots every 5 to 7 years, which prevent infections. Oxygen therapy will increase the life expectancy for that person with emphysema, and there is transplant and surgery, which may be an option too, which offers improvement in the lung function. Short-term and long-term consequences. As I said earlier, it's a slow progress. So in the short term, you will be having short of breath, you'll be wheezing, coughing, but in the long run, these symptoms become severe. The patient can develop anxiety and weight loss as the disease progresses. Emphysema also causes the lung to take a permanent parallel shape to compensate for the actual dysfunction by expanding, which the shape was shown to you earlier. Thank you, and thank you for listening. I hope it helped.